Health and wellness policies incorporate two powerful cultural significances, food and children. In this presentation, you will learn about the key policies affecting health and wellness in the United States.
In 1946, Congress passed the National School Lunch Act when food supplies dwindled during World War II and the amount of school meals served declined significantly. This act assisted many states to provide an adequate food supply and equipment, expand nonprofit school lunch programs, and ensure the health and wellness of children. In 1966, the Children's Nutrition Act of 1966 extended, expanded, and strengthened the government's efforts to meet the nutritional needs of children. This act added more subsidies for low-income children as well as school milk and school breakfast programs. In 1968, the National School Lunch Act was amended by extending the eligibility for participation to students enrolled in nonprofit private institutions. This amendment also clarified language around dietary accommodations and nutritional requirements. In 1975, the school breakfast program was made permanent. The program provided all students with a nutritional breakfast every morning, regardless of students' ability to pay. In 1981, the Reagan administration significantly decreased federal school lunch spending by $1.5 billion. This reduced budget led to smaller lunch portions, reduced the number of children eligible for free or reduced lunch, and lowered nutritional standards. The Healthy Hunger-Free Kids Act of 2010 aimed to improve the quality of healthy food in school. This act addresses concerns of growing rates in childhood obesity by giving USDA the authority to set nutritional standards, provides additional funding to meet these standards, and sets basic standards for student wellness policies, including nutrition education and physical activity goals. This act increased funding and support for the National Farm to School Network, which allows schools to provide local and healthy produce for students. In 2015, the USDA Farm to School Grant Program increased the use of and improves access to local foods in schools while also fostering experiential food education for our nation's children. Currently, the Trump administration has made some adjustments to the recommendations and requirements of school lunch. They have relaxed a few requirements that were implemented under the Obama administration. There have been changes made to the fat content in milk, use of whole grains, and sodium content in school breakfast and lunch. In this video, Michelle Obama comments on these changes.
She may have left the White House, but former First Lady Michelle Obama is still fired up about healthy eating.
Think about why someone is okay with your kids eating crap. Why would you sit idly and be okay with that? Because here's the secret. If somebody is doing that, they don't care about your kid.
Obama spoke at the annual conference for Partnership for a Healthier America, for which she's the honorary chair, on Friday. And she was sure to mention the school lunch program, something her Let's Move campaign successfully sought to make healthier. The Trump administration relaxed some of the new nutritional rules for those lunches just days ago. Obama never actually mentioned the administration by name, but she didn't hide her feelings when the moderator, the former executive director of Let's Move, brought up another recent change and one being considered.
Delay on menu labeling so we don't have basic information and make choices in restaurants.
You should know what you're eating. We have to look our neighbors in the eye and kind of go, what is going on? Because this just isn't that complicated.
You know, there's now talk of delaying the nutrition facts panel, which is just another simple information so families can make better choices.
Keep families ignorant.
Yeah.
That's all I'm hearing.
Right.
The focus of health and wellness can be observed in four main policies that are currently in play: the National School Lunch Program, the School Breakfast Program, Farm to School Act of 2015, and the DC Healthy School Act. The politics surrounding these health and wellness policies involve a combination of ideals and frustrations, which can sometimes result in tension surrounding one of America's most popular social programs.
The National School Lunch Program serves more than 31 million children each year and costs more than $11.6 billion every academic year. The program has been shown to decrease the risk of food insufficiency and food insecurity among low-income households by up to 14%, which shows that the program plays a significant role in the lives of families. Studies have shown that the program can decrease obesity rates by up to 17%. And among children who have received free or reduced lunch, poor health was reduced by 29%. This demonstrates that the families benefit because it decreases poor health and long-term health care costs. One study found that policies still need to work on emphasizing the quality over the quantity of the foods that are served to our students. The school breakfast program provides breakfast to more than 11 million children each year and costs more than $3 billion a year. It provides breakfast to many low-income children who may not receive breakfast otherwise. The program has been shown to improve nutrition, which also improves cognition, memory, and overall brain development. Studies have shown that among schools who participate in the National Breakfast Program, absences are decreased either because they are getting food they would not be receiving otherwise, or there is a decreased amount of illness. Attending a school with the breakfast program can increase math achievement by 8% of a standard deviation, and many families reported that their children were less likely to skip breakfast if they attend a school that participates in the program. The school breakfast program in this infographic shows that 60% of school meal directors had few or no difficulties meeting higher breakfast standards, with 42% reporting a few challenges and 19% reporting no challenges.
The Farm to School Act of 2015 has had many benefits for the schools that participate. According to recent data, more than 30% of all children in the U.S. are overweight or obese. This results in a higher number of missed school days, poorer academic achievement, and greater medical costs over their lifespan. The amount of money farmers receive from the food they produce has also decreased. According to research, farm-to-school programs lead to reduced food waste, improve health outcome, and reduce rates of obesity and weight-related illnesses. This leads to cost savings for schools and a lower health care cost for families. Students have also shown that among the schools that participate in farm-to-school programs, that behavior problems are less prevalent, school clinic visits have decreased, and positive attitudes towards learning have increased. School gardens build a sense of community, increase healthy food consumption, and provide hands-on learning experiences for students. This act increased the amount of funding available to implement school gardens and health education.
The DC Healthy Schools Act was approved to help to do the overall health and wellness of students attending DC public schools. The law was supported by Kaiser Permanente and Walmart. The Healthy School Act addresses these areas: breakfast and lunch, school nutrition, farm to school, physical activities and education, health education, school environment, competitive foods, and health and wellness. This act was passed to address the problems of inner city kids that attend DC public and charter schools, with 43% of these kids being overweight and eating unhealthy foods. Terms. Wellness, the state of being in good health, especially as an active pursued goal. Also approach to health care that emphasizes preventing illness and prolonging life. Nutrition, the process of providing or attaining the food necessary for health and growth. BMI, body mass index, a key index to relating weight to height and determining obesity. DC CAS, a comprehensive assessment system that evaluates or measures performances in DC. Infographics, a visual presentation of information in the form of a chart, graph, or other image accompanied by minimal text intended to give an easy, understood overview, often of complex subjects. Public charter schools, a school chartered under the District of Columbia School Reform Act of 1995, shall not include private or parochial. sustainable agriculture, integrated systems of plant and animal production practices having a site-specific application, unprocessed, food that are nearest their whole, raw, and natural state, no additives.
In the current impact in the DMV area schools at Bryn Mawr Park Elementary School in Fairfax County, breakfast in the classroom was recently implemented through the National Breakfast Program. Since its implementation, more children have been served breakfast, and it ensures that each child receives a certain amount of nutrients each morning. It also ensures that all children are receiving breakfast for free, meaning that families no longer have to worry about the cost impact of breakfast at school.
Organizations.
Eagle Academy Public Charter School also has a local and personal chef that creates healthy meals for the students every single day.
Our chef, Chef Crooms at Eagle Academy Public Charter School, and his staff cooks our meal each and every day. He delivers it to 2 different campuses. He provides a healthy food program for our kids. He provides a healthy snack, introducing different fruits to our kids each and every day.
This video represents a local chef in Hawaii. The views expressed in this video help explain the local chef structure and help hold high standards that meet or exceed USDA standards. This is done at Eagle Academy Public Charter School through our personal and local chef.
It's a school lunch that includes Caesar salad with tofu dressing and fresh fruit, plus whole wheat spaghetti. Sounds like something celebrity chef Jamie Oliver serves up in his food revolution against childhood obesity. As KITV4's Mahealani Richardson reports in tonight's in-depth report, a local chef is trying to start her own food revolution, one plate at a time. From stay-at-home mom to chef on the go.
I drink coffee.
Chef Michi Watarai moves fast to cook, pack, and serve hundreds of healthy school lunches.
One plate at a time. We want to change the way that kids are eating.
On the menu, an all-beef burger with homemade terry sauce, whole wheat bun, baked potato wedges, organic carrots, and orange slices.
We're just cooking real food from scratch.
She includes lots of fruits and veggies, goes lower in fat and salt, and tries to stay away from processed foods. Chef Michi has food she absolutely will not serve. No white rice, no white bread, no fried foods, no Spam, and no chicken nuggets.
Your body is not meant to process chemicals and additives and all that.
Her inspiration comes from a famous chef.
This could be the beginning of a new era.
It's Jamie Oliver's Food Revolution.
Eat your vegetables!
Jamie Oliver's ABC TV show highlights his crusade against America's obesity epidemic and processed unhealthy school lunches.
We've got flavor that looks like it's been created there.
His recipes are just, throw a little bit there, and, it's not real precise. It's very much from the heart.
Just 3 years old, Michi's Cooking Fresh for You school lunch catering business services 6 schools.
I hear it again and again. Auntie Michi, what's for lunch today?
So you don't mind eating the healthier stuff?
No, I love it.
10-year-old Charles Lavoie and his Star of the Sea lunchmates were all smiles over this meal. He says he has more energy now that he's changed his old eating habits.
I would eat fries, I would eat candy, I would eat just things that weren't that good for me.
It's food for thought as Chef Michi tries to start her own food revolution. Mahealani Richardson, KITV4 News.
I'm straight from the kid.
At KIPP DC Public Charter School, they participate in the National School Lunch Program through a program called Revolution Foods. The nutritional content of Revolution Foods meets or exceeds USDA child nutrition standards under the National School Lunch Program, Child Adult Food Care Program, and Summer Food Service Program guidelines. All lunches on this menu are served with a fresh fruit and vegetable and are prepared and consumed on the same day. This requires cafeteria manager to report to work earlier in the morning to meet the delivery truck and package the meals for each classroom. The cafeteria manager states that this sacrifice is worth it in order to provide high quality and minimally processed foods to all students. There are also vegetarian, vegan, and gluten-free options available for students who have dietary restrictions. The school began serving Revolution foods 6 years ago and have noticed less students are bringing lunch and more students are opting to eat the breakfast and lunch provided by the school.
We recommend that implementing a school garden in your school, adding a salad bar, execute a lesson on healthy lifestyles, not teaching sedentary, which means getting up and participating in the importance of being an active person. And lead by example. Don't drink sodas, drink water. Get up and participate with your kids when they're out playing.
Found here are just a handful of current news stories that are captivating headlines around the country. While there are national regulations, there are different standards per state that determine the structure of their lunch and breakfast programs. We encourage you to find articles that speak specifically to your region.
How to advocate. When engaging in conversation, you should reach out to state Congress members, the Food Research and Action Center, and educators should inform the families that they serve about different programs. When looking at organizations that support health policies, some of the most influential are the Office of State Superintendent of Education, Center for Disease Control and Prevention, American Association of Health, Physical Education and Dance, and the Department of Health.
Health and wellness policies are complex as they integrate political agenda, children, and agriculture. While this PowerPoint touched upon 3 current policies, there are many others in place that deserve examination. When it comes to the combination of ideals and frustrations, health and wellness policies challenge all: elected officials, educators, food service, and most importantly, families and children.